Underserved communities throughout California are facing tremendous challenges as safety net services and benefits are being cut to make up for budget shortfalls. Promotoras are making public officials aware of the needs that exist in their communities, as they did in this recent meeting at State Assemblywoman Cindy Montañez's office.
We all work in different agencies, and it's the network that represents us. There's about 100 agencies and about 2,000 healthcare promotoras. This is the point we want to make. It's the diversity of the promotora, and everything the promotora can do in reference to not just giving education about health, but also mobilizing people to a consciousness of why it's important to be healthy. It's more than giving a class on health related to HIV or diabetes or high blood pressure.
Meeting regularly in 6 regions across California, promotoras come together to discuss ways they can strengthen their ability to serve their communities. In this meeting, facilitated by the nonprofit agency Visión y Compromiso and the Promotoras Community Healthcare Workers Network, Promotoras discussed the role of the promotora in her community.
What we find is necessary is to identify and analyze the problem, because sometimes we know that someone, let's say there's asthma in a community, right? But we don't know the cause of the problem, so they say, oh, they have asthma, then what we have to do is give them medicine, and the doctors do that. But what do we as promotores, healthcare workers, do? We identify the problem and we go to its roots. Like we see in San Francisco or San Diego, the services are here, the community is here. So then what the promotora does, she acts as a bridge for services to the community. What is it that we do as promotoras? Many times we take a role like mothers do in the home, the one that sweeps, that cleans, that brings, the one that does everything. Therefore, our role has to be one of motivating the participation of a community that is self-directed and constantly evolving.
As integral, invaluable, and trusted members of their communities, the promotoras have the capacity to inform, organize, and motivate residents to action. The promotora understands the needs of families, they hear what the residents are saying, they know the problems their communities face. By advocating, planning, sharing learning, and collaborating, promotoras are coming together to help inform and shape more relevant and responsive public policies.
We're passing from one stage to the next. This is a process we're forging as promotores and promotoras. How are we going to develop our programs? The important thing is to live the philosophy rather than to have it only in our heads.